Are you a fan of rehab?
Generally, no. Rehab is this idea that you go away somewhere for a week, a couple weeks, and then you're kind of cured, right? It's almost like people have thought of addiction as an infection where you need like 2 weeks of antibiotics and then you're done.
Mhm.
What we really understand is that for many people, addiction is more like a chronic illness or even like cancer, where you need a lot of treatment up front for the first few years. And then over time, you get into stability and remission, and you're almost like a cancer survivor. You're in long term recovery. And so, this idea that you go somewhere for a couple weeks and then you come out and you're all better really doesn't match what we know of addiction. The other problem is that much of what happens in rehab is not all that therapeutic most of the time. So, the things that we know are most effective for addiction, one are medications, which there's a lot of stigma and misunderstanding about. And then two are like evidence-based psychotherapy. So things like cognitive behavioral therapy, motivational enhancement therapy, working on your underlying trauma. Often in rehabs, the model is really built around this idea of like you remove yourself from this environment, you do some groups while you're there. Sometimes, often they're based on more of like a peer support model. Sometimes the therapies that are offered are frankly not very evidence-based. Like we actually did this study. It was a secret shopper study where we called rehab programs across the country to like ask about what they offered. And many of them offer things like, horse therapy or like dolphin assisted therapy, which like I'm sure it's very nice to swim with dolphins and to work with horses, but it's not something that's been like studied and effective. And many places don't offer the things that we know are actually effective, which are, trained clinicians doing evidence-based treatments or medication treatments. So it's a combination of like this short-term fix for a long-term problem and not actually getting the treatment that you need. So what does work, like for alcohol use disorder, most people don't know we have very effective medications that can help you, even if you just want to not drink as much.